So that is something that I think we can do a better job at assessing this otherwise subjective toxicity, and we really want to do a better job at that. I think one thing I'll also add is alopecia. And when we had our late-line trials with T-DXd, certainly the alopecia rates reported were much higher. And so while I'm starting a patient on T-DXd, I certainly talk about alopecia all the time, but I'm sure we all have appreciated the fact that fewer patients actually land up having higher grade alopecia, and most people actually land up keeping their hair. And so I probably scare them a lot more than what actually I see in clinic, which is not a bad thing. I'd rather do that than not. And then some patients always ask about scalp cooling, and we're still trying to understand. I mean, these are longer half-lives. These are, antibody drug conjugates, which are different than our other agents. But if a patient is wishing to do that and wants to try that, we have trials ongoing addressing the question, but I don't say no. I just make sure that they understand we don't know if they are keeping their hair because of the scalp cooling or because they would have otherwise never lost it anyway.